Hi, I'm Dr. Geeta, consultant fertility specialist at Medicover Fertility. Medicover Fertility is the leading European fertility chain. With its clinical expertise, state-of-the-art laboratory, and advanced technology, is a one-stop solution to the problem of almost all fertility treatments. Our clinics advocate quality treatment guided by national and international standards so as to make it ethical, cost effective, and reliable for our patients. The entire team puts in the best of their efforts with a core value of passionately serving childless couples in the journey of parenthood. We never settle for any less, but perfection in our patients' treatment and always keep updating ourselves in terms of technologies and treatment facilities. In an intent to give better experiences to our patients, it is the outcome of a quality treatment that every 3 years a Medicover baby is born worldwide. Now, today I am going to speak with what is ovulation. Ovulation is a part of our menstrual cycle. It occurs when an egg is released from your ovary. It may or may not be fertilized by sperm. If fertilized, then it may travel to the uterus and implant to develop into a pregnancy. If left unfertilized, the egg disintegrates and the uterus lining is shed during your period. This is called menstruation. Understanding how ovulation happens and when it takes place can help you achieve a pregnancy or not. Now, let's talk about the fertile window. The 6 days leading up to and including ovulation make up what's called the fertile window. This is the period of time when sexual intercourse may lead to pregnancy. The sperm may wait around for several days in the fallopian tubes after sex, ready to fertilize once it's finally released. Once the egg is in the fallopian tube, it lives for around 24 hours before it can no longer be fertilized, thus ending the fertile window. Symptoms of ovulation. Impending ovulation can cause more vaginal discharge. The discharge is often clear and stretchy. Sometimes it may resemble raw white eggs. After ovulation, your discharge may decrease in volume and appear thicker or cloudier. The ovulation may also cause the following symptoms: light bleeding or spotting, breast tenderness, increased sexual drive, ovary pain characterized by discomfort or pain on one side of the abdomen. It is not like that everybody experiences symptoms with ovulation. So these signs are caused secondary in tracking in your fertility. How to track ovulation at home? Well, the most accurate way to confirm ovulation is with an ultrasound or hormonal blood test, which can be ordered by your doctor. You have options when it comes to tracking ovulation at home. Ovulator prediction kits. These are generally available OTC at your corner drugstore. They detect the presence of the LH in your urine, which usually means you will ovulate soon. Fertility monitors. These are also available OTC. They track two hormones, that is estrogen and LH, to help identify your fertility window. Fertility monitors can be pricier than options that track LH only. When should you visit a fertility specialist? If you are looking to get pregnant in the near future, consider making a preconception appointment with a doctor. They can answer any questions you may have about ovulation, tracking, as well as advise you on how to time your intercourse to increase your chances of pregnancy. They can also identify any conditions that may be causing irregular ovulation or other unusual symptoms which impeding you to cause pregnant. If you are trying to conceive, a doctor can help you to choose the right method of contraception for you.
Hi, this is Dr. Sri Chandana. Let's discuss how lifestyle changes fertility of a female of a couple. So, India has seen drastic increase in the lifestyle changes in the recent times, especially in younger population. So, these lifestyle changes not only affect the overall health of individual, but also they have significant impact on fertility. So, from smoking to alcohol consumption to excess use of contraceptive pills, there is an increase in the poor lifestyle choices that affect fertility of a couple. And these are one of the key drivers to cause infertility in both men and women. So, the most important lifestyle changes that affected fertility are smoking, alcohol consumption, excess contraceptive use, obesity, stress, seeking fertility, delaying, postponing the childbirth, late marriages, career oriented behavior, excess stress. All these are the leading causes of infertility. And not only these, even certain medical conditions like PCO, endometriosis, premature ovarian failure, and even congenital problems of the genital organs like uterus, ovaries, and the fallopian tubes also can lead to infertility. So there is a need to create awareness about these infertility factors, about the proper lifestyle habits we have to follow, and when to seek fertility care. So let's see how these lifestyle changes have affected fertility of a couple. So from smoking consumption, smoking it leads to decreased sperm count, decreased sperm motility, altered spermatogenesis. That means altered sperm production capability, and even it causes low testosterone, that is hormone of a male. And in females, it leads to infertility by causing early menopause and hormonal imbalances. Excess alcohol consumption also leads to infertility apart from the overall ill effects on health we know. And these include it causes reduced sperm motility, reduced sperm count, low semen volume, low semen quality, and in females it leads to hormonal imbalances leading to irregular menstrual cycles and infertility. So even excess use of contraceptive pills is not advisable for a couple. These excess use of contraceptive pills can lead to infertility by causing hormonal imbalances, anovulatory cycles, irregular menstruation, and infertility. Even excess weight or low weight also leads to infertility. So, overweight, that is having their body fat more than 10 to 15% of the normal range, can lead to infertility by causing alterations in the reproductive cycle, hormonal imbalances in the menstrual cycle of a female. And low weight, that is underweight, less than 10 to 15% of the normal body fat, can lead to infertility by completely shut downing the reproductive axis and its working. So even certain environmental factors like prolonged working hours lead to excess mental stress and excess exposure to high temperatures, excess exposure to chemicals, radiation, electromagnetic waves, microwave emissions also can lead to infertility. Even certain social factors, as I told you, like delayed marriages, delayed childbearing, and can lead to infertility by causing one alteration of the menstrual cycle, by causing hormonal imbalances, and by causing chromosomal aneuploidies, early miscarriages, and even overall health of the individual is affected. So when we see here, there are many factors that lead to infertility, including ethnicity. So India has seen a drastic increase in infertility cases every day. So there are about 22 to 33 million infertility cases in couples who are affected with infertility in India. So there is a need to address the causes of infertility, to address the preventive measures, treatment options, and when to seek early fertility care for these couples. Young women especially are advisable to follow healthy lifestyle habits, regular exercises, and maintain a proper balanced diet. So they have women who have irregular menstrual cycles or prolonged menstrual cycle, or who are not able to conceive even after 1 year of unprotected intercourse, or who are postponing the childbearing after 35 years of age, have to seek expert opinion, fertility expert opinion, and follow their advice. Thank you. Medicover Fertility is the leading European fertility chain. With its clinical expertise, state of the art laboratory, and advanced technology, it's a one stop solution to the problem of almost all fertility treatments. Our clinics advocate quality treatment, which is guided by national and international standards, so as to make it ethical, cost effective, and reliable for our patients. The entire team puts in the best of their effort with a core value of passionately serving childless couples in their journey of parenthood. We never settle for any less. but perfection in our patient's treatment, and always keep updating ourselves in terms of technologies and treatment facilities in an intent to give better experiences to our patients. It is the outcome of our quality treatment that every 3 hours Medicover baby is born worldwide. Thank you.
Hello everyone, I'm Dr. Runa Acharya, Senior Consultant Reproductive Medicine and Surgery at Medicover Fertility, Hyderabad. Now today let's discuss about what's ICSI. Now if you look at ICSI, it's a upgraded IVF, which is a conventional IVF. Now when we look at ICSI, it's the injection of the sperm into the oocyte directly. Whereas in conventional IVF, we mix the sperms and the egg together and keep them in culture dishes and then look for the fertilization next day. Now, what would be the advantage of ICSI over conventional IVF? Now, when we mix the sperm and the egg together, there are millions of sperm around the egg and one sperm makes it to fertilize the egg. So, it has to penetrate the zona, that is the covering of the egg. In ICSI, we bypass this process of natural fertilization. We take the sperms into injecting needles and we inject one single sperm into the oocyte. Now, if you go into the stepwise process of ICSI, now the basic starting of the stimulation or the starting of the entire program is as similar to the IVF, that is a conventional IVF. The patient is selected, the woman is seen on the second day. If all is good, she started with stimulation, that is injections are given for the next 10 to 12 days. The scans are monitored, her egg growth is seen how she's going, and whenever she's ready, that is the eggs look mature, that's the follicles have reached the target size, we trigger them with the HCG injection and the oocyte retrieval is planned. On the day of oocyte retrieval, the sperms are also taken from the husband. The sperms are prepared, the sample is prepared so that all the motile good sperms are separated. The eggs are looked for the maturity. The mature egg is placed in the the dishes, and with the help of injecting needle, one best sperm, which looks morphologically normal, is taken and injected into the oocyte. After this, the oocyte, which is having the sperm inside it, is kept in separate culture dishes and washed over for the next 3 to 5 days for the fertilization, cleavage and the formation of blastocyst. Now coming to why ICSI would be preferred over IVF, there would be certain conditions definitely which would benefit ICSI rather than the conventional IVF. Now what are those conditions? Now naturally maybe the sperm is not able to penetrate the egg. That's the sperm is not good enough, it's not very motile, or the morphology is poor in majority of the sperms. Or the egg has a very thick zona. That's could be happening in certain unexplained or PCO cases. So in such cases, the barrier is taken away artificially and the sperm enters the egg. So these are some conditions where, or there could be some conditions like previous failed IVF. So these conditions where we anticipate a fertilization failure are the best candidates for ICSI, that's intracytoplasmic sperm injection. Medicover Fertility is a leading European fertility chain. With its clinical expertise, state-of-art laboratory, and advanced technology, it becomes a one-stop solution to almost all the problems of fertility. Our clinics advocate quality, ethical treatment guided by all the national and international standards so that it's cost-effective and reliable to the patients. The entire team puts in their best of efforts with a core value of passionately serving the childless couple in their journey of parenthood. We never settle for anything less than perfection in our patients' treatment, and we believe in keeping ourselves always updated in terms of technology and treatment facilities. In an intent to give better experiences to our patients, it is this outcome of our fertility treatment that every 3 hours, one Medicover baby is born worldwide. Thank you.
Myself, Dr. Gayatri Reddy Patlolla. I'm a Senior Consultant Fertility Specialist at Medicover Fertility, Hyderabad. And today I shall be talking about IUI, IVF and IUI versus IVF. So usually couples who are having trouble conceiving may be wondering if they should undergo fertility treatment and what type of treatment would suit them the best. So two procedures are commonly used to help couples who need fertility assistance. The first is the IUI, that is intrauterine insemination, where processed sperm is placed directly into the uterus using a speculum and a fine IUI catheter. Then comes the IVF, which is in vitro fertilization, where the eggs are surgically removed using a needle that is passed through the posterior surface of the vagina, and those eggs are fertilized artificially outside the body. Generally, fertility specialists will run some tests and then advise you on the potential treatment options based on the results of those tests. Medicover Fertility is the leading European fertility chain. With its clinical expertise, state-of-art lab, and advanced technology, is a one-stop solution to the problem of almost all fertility treatments. Our clinics advocate quality treatment guided by national and international standards so as to make it ethical, cost-effective, and reliable for the patients. The entire team puts in the best of their efforts with the core value of passionately serving childless couple in the journey of parenthood. We never settle for any less, but perfection in our patients' treatment are always keep updating ourselves in terms of technologies and treatment facilities with an intent to give better experience to our patients. It is the outcome of our quality treatment that every 3 hours a medical baby is born worldwide.